Hi everyone, welcome back to the new session on skilled birth attendant. Shortly we can call it as SBA. I'm Professor Dr. Beulah Dallas, HOD of Community Health Nursing Department, Triple M College of Nursing. According to WHO, they are defining the skilled birth attendant as an accredited health professional such as a midwife, doctor or nurse who has been educated and trained to proficiency in the skills needed to manage normal pregnancies, childbirth and the immediate postnatal period and in the identification management, also referring of complicated cases in women and newborn. What is the qualification of this skilled birth attendants? Midwife, often the primary skilled birth attendants trained to international standards. The doctors, including obstetricians and other physicians. Nurses, especially those with specialized training in maternity care. Maybe a staff nurse, maybe the degree nurses. Auxiliary nurse midwives, they are called as ANM or multipurpose health worker or lady health visitors. In some contexts, these paramedical workers are trained and empowered to act as skilled birth attendants for basic and emergency care. The objectives of skilled birth attendants are to provide essential care of the woman and newborn during the antenatal period, labor and postnatal period, especially the normal cases, uncomplicated cases, to provide essential care of the newborn and its importance for the health of the baby, to identify clinical features and initial management of the common obstetrical complications during the antenatal period, labor and postnatal period. That is, they will able to manage the normal cases of antenatal mother during their pregnancy and the newborn child. But in this complicated cases, they can identify the risk and they can refer them to the referral services. What are the skilled based objectives? They can measure the blood pressure, pulse and fetal heart rate, checking for pallor and edema, determining the fundal height, fetal lie and presentation accurately, performing hemoglobin estimation and testing for proteins and sugar, conducting pelvic assessment to determine pelvic adequacy, plotting the partograph and knowing when to refer the women. So they can able to identify the risk, they can able to judge how to take care of the normal antenatal mother and the normal newborn. So there are three modules are there in that they are teaching the essential skills to conduct or manage the normal deliveries and take care of the normal newborns. So first module teaching about management of normal pregnancy, labor and the postpartum period. So here the care during pregnancy, that is proper antenatal care, care during labor and delivery, that is during the intrapartum period, how to conduct the delivery with the safety and sterile method. Care of delivery, and that is after postpartum care. Till 42 days of the care, they will be able to provide essential care to the mother. And the second modules teach about management of common obstetric complications, prevention and active management of third stage of labor, management of postpartum hemorrhage, management of eclampsia, prevention and management of infection. What are the signs and symptoms and what are the management and when to refer. All the details will be teaching through this module 2. And next module 3, here they are teaching about ensuring the quality of care, awareness of the community regarding danger sign during pregnancy, after pregnancy and during the labor, including mother and child, counseling and supportive environment, provide much privacy as possible. What is the importance of this skilled birth attendants? Why we need them? The presence of skilled birth attendants at deliveries significantly reduces maternal and newborn mortality, it making it as a key global health indicator for improving maternal health outcomes. Managing uncomplicated pregnancies, that is normal cases, childbirth, and the immediate postnatal period. Identifying and managing complications in women and newborns and making referrals. Timely and life-saving support and intervention are a must. What are the limitations of the skilled birth attendants? They have the permission to use uterotonic drugs for prevention of postpartum hemorrhage, permission to use drugs in emergency situations prior to referral for stabilizing the patients, permission to perform basic procedures at community level during the emergency situation. What's the key roles and responsibilities of skilled birth attendants? Care during delivery, managing uncomplicated pregnancies at birth, postnatal care, providing care for the mother and newborn immediately after the birth, complication management, we can able to identify managing and referring obstetric and neonatal emergencies, and emergency interventions like using essential drugs like uterotonic for bleeding and providing stabilization before referral. Let me conclude this topic. A skilled birth attendant is a trained health professional like a midwife, doctor, or a nurse, proficient in managing normal pregnancies, childbirth, and the immediate postpartum period, identifying and managing or referring complications for mothers and newborns, crucial for reducing maternal newborn death. Skilled birth attendants provide essential care, administer life-saving drugs, and know when to refer to higher level facilities, playing a key role in safe motherhood globally. Thank you for patience listening.